Okay, I'm really honored today to introduce Jim Mann, our guest. He's an accomplished businessman, volunteer, and advocate. Now, I'll post his full bio on the website for all of you to read, but I wanted to take a moment to highlight here that Jim has been a passionate advocate for people living with dementia since his own Alzheimer's diagnosis at the age of 58 in 2007. Jim has been the recipient of numerous awards, including the Queen Elizabeth II Diamond Jubilee Medal and an honorary doctorate from the University of British Columbia. And in so doing, UBC recognized Jim, and I'll quote here, as the most influential person in Canada in countering stereotypes and building a more inclusive society for people living with dementia. Wow, that's really, really high praise. So it's an honor to be here with you today, Jim. Thank you so much. We're really, really fortunate to have you join our class.
Thanks for the invitation.
So I was wondering if we could start off by just telling us a little bit about your own journey with Alzheimer's. I know it's something you've lived with, both a caregiver for your mother and then with your own diagnosis. So maybe we could just start from the beginning, when you got that first diagnosis and how that felt.
Well, I guess it was a bit of a happy and sad moment. Happy to, I guess, have a label and or a better understanding of some of the issues I was having. But it was still an adjustment that I was going to have to make. And I had seeing my mother, because I was diagnosed when my mother was still living.
Oh, wow.
And so my wife and I had sort of followed her along from my father passing away and then going a number of years later from her condo into independent living and then long-term care. But along the way, I saw some of the issues that she was having with dementia. And then when she was in independent living, I saw the stigma of dementia, so that by the time I was diagnosed, I really had an understanding of some of the areas of need, some of the areas of concern for people with dementia. And my own background was marketing and communications, and I had been a lobbyist for my employer for a number of years. And so I just sort of combined my diagnosis, my experience with my mother, and my business experience. And so the rest is history.
So
I really advocated on some of the issues.
And I'd love to talk to you about two things you mentioned. The first is the issues that you witnessed with your mother and the problems. And the second is your advocacy. So why don't we first start with the issues you witnessed and also those you've perhaps experienced and what you would like people perhaps thinking about a career in health policy or healthcare to know and perhaps to improve in those issues that you've experienced.
I don't remember. The question was really long and I don't.
Sorry, yeah. So what are some of the challenges that you've observed for people living with dementia?
I always remember sitting, waiting to go in to the dining room when Mom was in independent living. And I was sitting there with her and I noticed these two older ladies standing, also waiting to go in for lunch. And they were looking over at us. And I really knew that they weren't talking about me. They were, or talking about us, but they were talking about what my mother may or may not have done. And then on top of that, one other day, I was returning to my home from downtown, And I stopped off at what would have been around the end of their lunchtime. And so went in and went up to the table because they always sat at the same seat, same table. And I walked up to the table and my mother wasn't there, which of course brought so many thoughts to my mind, what's happened to her. And so I asked where she was, and they pointed over to the table in the corner. Oh, she's moved. And so I realized then that they just were, tired of listening to the same stories or getting the same questions asked, and so it was that realization that the stigma of dementia is not with any one person, with any one group or demographic. It's her peers, the same people her own age, and which is also what others experience when you get your own diagnosis, that the friends that you've had for years will not necessarily call you as often, and just simply because they, in a lot of ways they don't know what to say, but in a lot of ways it's more they want to leave dementia at arm's length. They don't really want to get into hearing that much about it or knowing some of the specific challenges that you are having. And so it becomes very difficult. And so the idea that people with dementia go from diagnosis into long-term care right away is prevalent in society. And so, certainly one of the things that I continue to do is talk to people about, you get diagnosed, but man, there's a journey in between, and a lot of people can live very well. They need a purpose, they need a reason to get out of bed in the morning, but they do live well. And so you can't drive, you can take a bus. There are ways around these things. And it's that immediate, or that assumption of incapability that comes right away. There's a fellow I know who was a longtime member of a golf club, long time, and people would go to him all the time for rules and interpretations, and he always organized men's night, and which he was doing, and then his friends at the club were told that he had Alzheimer's, and just like that, no one went to him about a rule anymore. And they said, "Oh, don't worry about organizing men's night, we'll do it." Just as if overnight you became incapable.
Wow, that is awful to hear, and so clearly wrong-sighted. I mean, you're sitting here, how many years now since your diagnosis?
15, I guess.
15, and we're having a discussion for university level course in which you are contributing incredible insights. So to brush people off like that is completely based in ignorance, isn't it?
Yes, yeah, because it's just that immediate assumption.
Yeah.
And it's everywhere. I mean, in business, people tell HR or their boss or whatever that they have mild cognitive impairment, or have been diagnosed with Alzheimer's, and many companies will, just send you out the door and without making any kind of allowance for, making it an easier transition and adjusting a job in some ways. Of course, some can't be, but in many cases there are ways, and that's why some research projects are so vital
Yeah.
for the community in general, but for people living with dementia. And certainly I've continue to have the honor of being involved in some research projects. So
I saw that you were involved in something called Jim's Push for Change a little while back. This is a health policy class. Do you have any health policy suggestions to help improve the lives of those living with dementia and their caregivers? So health policy.
The one thing that it was a fabulous campaign that the Alzheimer's Society of BC did, Jim's Push for a Plan, and we were pushing
Yes.
for a provincial dementia strategy, which of course we still don't have. But in that, I made it a point of saying we need a better educated workforce. Because there are doctors and nurses, there are occupational therapists, there are people in different lines of work and so on that don't understand dementia. And when you get into people providing care or services related to care, that sort of thing is just prime importance. And I was an advisor to a PhD candidate a number of years ago, and who was in acute care. And in her thesis, she quoted a nurse who said that nurse had friends throughout the hospital, and those nurses were afraid to go into the room of a person with dementia. And when you have that kind of ignorance about a disease, about a syndrome, that immediately alters your ability to provide care. And it also may affect your approach to the individual, to the point that maybe the person with dementia will push back. And as soon as you do that, of course, you're combative, there's responsive behavior, and you get a little mark that on your file that will never leave, and over something that really wasn't your own fault. And so there is that need to better understand dementia, to better understand an approach to a patient or a resident in long-term care. That PhD candidate I was advising asked me to go to her ward and talk to staff. And in fact, word got out and throughout the hospital, and it was standing room only. And because others wanted to understand an approach to people with dementia. And I talked to them about, right now you're rushing into a room, you're barking an instruction to a patient, and then you're turning around and you're responding to somebody that no one can see. And whereas if they went in regularly and or normally, and then engaged, made sure that the patient was focused on them, and said, okay, this is what we're going to do, and, you know, work them through it. I said, you will get out of that room faster. And many of them said to the person I was advising that, wow, that really does work. And so it's that kind of need, although, you know, it's easy to say, yes, you know, we give doctors or we give care aides or whatever so many hours about dementia, but maybe you're dealing with just the medical side and not the actual practical side. And so for me, that becomes, you know, the primary focus is just that better understanding of dementia from the practical perspective and not necessarily from the medical perspective.
That's really, really good advice. Is there anything you think could be improved at the governmental level in terms of funding, or like you've talked a lot about the interpersonal situations and the stigma? Is there something you think the government could improve as well?
Well, as far as funding is concerned, always.
Yeah.
I mean, it will be a never-ending demand from provincial governments to the federal government. We need more money for healthcare. But giving, you know, having money set aside for that better educated workforce would be a big help. But also the realizing that people with dementia are human, that they are maybe in long-term care ultimately. They still have a life to live. They still have contributions to make. And so the dedication of monies to long-term care is needed, is vital, is important. And I mean, when I read a paper, I underline what I feel is important, and then I type it into Word, and so that I might remember it a bit more. And I was doing it with a paper earlier, and you know, the attitudes about or you know, really the extension of the stigma of dementia, as far as you know, it's let me reword this. So often you hear about people, you know, suffering with dementia. And I think in many cases, the individual who is living with dementia is not the one that's suffering. And so the family extends that suffering to the person with dementia. And so when a person passes away from dementia, they say, oh, it's such a blessing. And they have not, in my mind, taken the time to realize the value of that person, and realizing that fine, your husband, your father may not remember you or remember your name, but as one individual with dementia said as his wife, who would visit him almost every day, as she was getting up to leave, he put his hand on her arm and he said, "I may not remember your name, but my heart says I love you." And so that there is that connection and there is still that value. And so to diminish the role of long-term care, to diminish the need for better funding of long-term care, again, partially for education, but partly for the upgrade of some standards. It is so important. It's not like the ALC, the alternate level of care in acute care hospitals that I call warehousing. It's they should not be going to long-term care and just sit there in front of a television, all in a row of seats or whatever. And if a recreation therapist has to take a medical leave, you replace them. You don't say, "Oh, well, for 6 months, we don't have any recreation." It's that kind of attitude that is so important to change.
And I know things have only become worse in the COVID pandemic,
Yes.
right?
Yeah, yeah. And that's where the technology, I'm a co-investigator of a project using telepresence robots in long-term care to partially assist with families and residents able to connect. So far, the project is working very well.
Wow, that's really neat. I'd love to share some information about that whenever it's ready with the students.
Yeah, it's there's a few papers that have been written about it so far, and about the input from staff and some of the tests as it has occurred early on, but there's been a fair bit of media about it, and it's been a great project, and I actually used it as she and I were winding up another project, and or the researcher and I were winding up another project, and I was here in my office in Surrey, and the long-term care home was in Richmond, and I was controlling the robot.
Wow.
And I went from the lounge, headed to the dining room, and on my way, I passed a man who, wanted to engage with me, and it was as if I was there,
Amazing.
in person, and we were laughing and having a good conversation. So it's not the oh my God, what are they going to do with this black machine that only has a sort of a big screen on it? Didn't matter to the people that I talked to in the home. It was fabulous.
Well, technology is wondrous. Even the fact that we're able to connect from opposite ends of the country right now and then
Yes.
present this to a group of students who will see it in the future, it really is incredible.
Yes. Yeah.
If you think about it.
Yeah.
Well, thank you so much. Did you have anything else you wanted to add or that you'd like the students to know? That kind of wraps up the main questions I wanted to ask.
No, I think the point, I guess, is more along the just the ask of don't make assumptions. Don't make assumptions on the basis of seeing on a patient's file or seeing somewhere that the person has dementia, and make up your own mind and not assume that, oh my God, this is not going to be going anywhere, or I will have to talk to the man's wife or daughter or whatever. Try to communicate to the individual. You'll be surprised.
I think that's such an important message. And I'm really glad you're able to share it with us today. Thank you so much for your time.
I appreciate the opportunity.